Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for the Appalachian Highlands for the week of July 19th. I talked in a previous video about a mature epidemic. That's one where the growth rate slows down dramatically and eventually approaches zero. I pointed out that in the United States, we're not quite there. We're still decreasing, but we're not approaching zero. If you look at the percent week over week growth rate in the US, it has been dropping and then seems to have leveled off and actually maybe coming back up again, meaning we're seeing a growth of the epidemic. If you look at Virginia, which followed a similar pattern until a few weeks ago, and then it seemed to be growing and now has slowed down again. So we'll keep an eye on that. But overall, if you look at the number of cases and the 7-day average in Virginia went up, it's come down, and now it's gone back up again. And the same is true with deaths. Deaths started to go up, it came down, goes down. But because deaths follow cases by about a month, we may start seeing these numbers going back up again. Tennessee, on the other hand, is really all over the map and it really isn't approaching a stable, mature epidemic. The growth rate has been continuously going up of new cases. Death rate has done pretty much the same thing. So Tennessee, certainly more so than Virginia and more so than the rest of the U.S., does not appear to be approaching the status of a mature epidemic, at least not statewide. If you look at the Northeast region, the blue line is new cases, the 7-day average. The red line is hospitalizations. And what you can see is that both are growing fairly consistently. If you look at new cases, both 7 and 14-day averages for the entire Appalachian Highlands, you can see that it's going up. So just as I mentioned for Tennessee, our region is not yet at a mature stage. It's still growing, it's still going up. And so we have to continue to be quite cautious. In terms of total numbers, Tennessee has reported almost 80,000 cases and over 800 deaths. Virginia has about the same number of cases, but almost 3 times as many deaths, suggesting that Tennessee is doing more testing than Virginia. Our regions had 13,000 cases and over 200 deaths. So we're in the midst of an evolving pandemic. It appears to be growing worse in the South and the West in the United States, and certainly hitting Tennessee at this point in time. So it's definitely something we want to keep an eye on. There's a great deal more information about COVID-19 on our website. If you go and hit this icon, you can search through different videos that we have, or if you have any specific questions, please let me know. I look forward to trying to find an answer for you. Thank you very much.